cCMV stands for Congenital Cytomegalovirus. Hold on a second, that was a mouthful. Let's break that down. Congenital Cytomegalovirus. Congenital means at birth, cyto stands for cell, and megalo means very large. So basically, it's a large virus that attacks the cells of infants when passed from mother to child before birth. Based on the number of children who are born with conditions per year, cCMV is very common. In fact, it's more common than fetal alcohol spectrum disorder, Down syndrome, and spina bifida. But only 9% of women and 5% of men in the US are aware of cCMV. 90% of adults will have been infected with the virus by the time they're 80, but most just feel like they have a cold or they don't show any symptoms at all. But when infants are infected with the virus, it can be very dangerous. 1 in 200 infants is born with the infection, and unlike adults, 20% will develop long-term health problems. These may include vision loss, seizures, and growth problems, but the most common long-term effect of the infection is hearing loss. Not all symptoms can be seen at birth. For example, hearing loss may be present at birth or sometime after birth. So how is CMV spread? CMV is spread through bodily fluids such as urine, saliva, and blood. Women who work with young children or who have young children of their own, especially if they're 3 years of age or younger, are at a greater risk of contracting the virus. But how does it actually pass from the young child to the woman? Well, we know that kids like to put toys in their mouths, right? If a woman picks up the toy, doesn't wash her hands, and then goes to eat a meal, that's one way. Or maybe she's feeding her baby with a spoon and puts the spoon in her mouth for a brief second. Easy to do. Or even kissing a child directly on the lips. Women who are or who plan to become pregnant can prevent their risk of getting infected with CMV and passing the virus to their child. How so? By following simple, healthy habits like the following: not sharing food, utensils, drinks, or straws with young children, not putting a pacifier in your mouth, not kissing a child directly on the lips, not sharing a toothbrush with a child, and washing your hands after changing diapers or touching kids' toys. To recap, cCMV is the most common infectious condition present at birth. CMV usually doesn't cause symptoms in adults, but cCMV can affect infants. It's a leading cause of childhood hearing loss. CMV is spread through bodily fluids, and women who are around young children should make sure to protect themselves by following simple, healthy habits.